Cumberland District. We have Amy Tomlinson, our Executive Director, and Laura Woodrum, Director of Nursing, with us today. We have a couple of questions, but I do want to remind you all, if you all have any questions, please put those in the chat box as we go through the meeting today, and we'll answer those. First, though, I'm going to turn it over to you, Amy, I'm sorry, and see if you want to share some updates.
Thank you, Tracy. Yes, I will give you all an update, and hopefully we have good news to share today. We are actually seeing a downturn in our positive cases that are being reported. So that is very encouraging news. I'll try to go ahead and share my screen and show you our latest case summary that we have available. This was sent out last night or early this morning through our public information brief. It's available on our webpage. You can see that we reported 203 cases yesterday across our 10 counties. And that makes us have a total active case count presently of 650 cases. Of those, around 89 or so are hospitalized. 561 would be self-isolated. And we have had a total since the beginning of the pandemic of 643 deaths that we have reported. So to put that in just a tiny bit of perspective for you all, the last time we did a media brief like this for you all was on September the 29th, I believe, 2 weeks ago. And so for the past 2 weeks, on September 29th, we reported 1,143 active cases. So that compares to yesterday's 650 cases. And so that would be a decrease of around 493 cases, which is about 40 to 43% a decrease in cases. So that is wonderful news. Our deaths, however, have gone up. We were sitting at around 608 deaths when I announced that at our previous media brief, and we now have 643, which is an increase of 35 deaths that we've reported over the last couple of weeks. So that is to be expected with the high number of cases we've had. We are well aware from previous surges and things that typically hospitalizations and deaths follow 2 to 3, maybe 4 weeks behind sometimes on those spikes in numbers. So we still expect to see some higher numbers in those areas for the next few weeks, but hopefully that is on the downturn also. Having spoken to our hospitals for the past little bit, they are reporting stabilization, I guess is the way I should describe it. It's that they're not necessarily seeing that significant of a decrease in admissions and hospitalizations yet, but they're holding their own. They're not increasing at the moment, and they're able to handle what they have, I think, better now than previous weeks and months, because there's more beds available across the state. With a decrease in cases, it's easier to find placement. Some of our hospitals have had National Guard teams assigned to them to assist, to free up staff, to make staff available for treatments and other things. So that is all very, very helpful to our region, and we are greatly appreciative of those efforts. Let me share my screen one other time, and I will show you. This is the picture, I guess, of what I've been trying to say to you all. This is our trend from the beginning of COVID until now. So you can see this was the spike that we had around the holidays last year, the first of the year this year. This is our latest spike where we've been dealing with for the last couple of months. And you can see that as of last Saturday, the 9th, our district-wide transmission rate was sitting at around 53.06. And that is significantly down from our peak on September the 4th of 101. So we are definitely coming down. The last dot here shows 0, and that's because I think I say this every time, but the full week's worth of data has to be available for this chart to update for the week. So it will update after Friday's report. It may probably be Monday, because I have to wait until the state reports some numbers too over the weekend. So probably on Monday that last dot will actually be in place. But we were looking at around, I think the number for Monday, Tuesday combined this week was around 350-ish cases, I think, for the 2 days. So that's a good number. That's looking like it will be another down week for us. So all encouraging, all good news. And I'm very, very happy to share that information with you all.
It is good news. First question, and this will be for Amy, Laura, whoever wants to answer. For the people that are vaccinated for COVID-19 and then get COVID-19, Is there any data on which vaccines are causing these positive cases? And can these numbers be put into your daily reports?
I'll answer that. This is Laura. Um, we don't always know. Folks can't always tell us what type of vaccine that they received. So there's really no way for us to know. The ones we do know when the folks report to us are fairly equal across the board. Now, we gave more Moderna vaccine in our district just because that's what our supply was initially. So if we were to count those, it wouldn't be equal across all three vaccines just because the availability of the vaccine throughout the district.
I think we were chatting too before this started, and we discussed things like the factors that go into the efficacy of the vaccine, the chance that you're going to have a breakthrough. There's a lot of things that go into that, and it's not just the brand of the vaccine. Sometimes it has to do with underlying health conditions or any immunocompromising conditions that the person may have themselves. It has to do with their age. There's lots of factors that go into a breakthrough case. So I think that just the brand name of the vaccine isn't necessarily a trigger or a indicator of its effectiveness. But having said that, from what we do see in our breakthrough cases, I think that it's fairly evenly spread across the brands. I don't think that there's any indication that any one brand is more so likely to have a breakthrough than others. I think there's a lot of factors that go into that. So I would say more so than the brand name is some of those other types of things to consider too.
Thank you all. That's the only question I have. I'm not sure if there are any on YouTube.
Tracy, you and I spoke yesterday too about the decreasing in cases and the frequency of these briefs that need to be held and some of that. And I think we're going to maybe discontinue these on a regular basis and just do them on an as needed basis moving forward. And unless something happens, as long as things continue to go down and there's not a lot of updates, we'll probably just push out our information through our public information brief that we do daily. And hopefully at some point we can get back to doing those weekly. When this previous surge had happened and had kind of resolved, we had gone to weekly reporting on some of that for a while. So I'm hopeful that that may be in our future at some point too. But we will continue as long as our cases are in the hundreds for sure. And our counties are all still red, which they are. And I did not previously mention that on our update, but all of our 10 counties are still in the red zone transmission, high transmission rates, but they are significantly down from where they had been. So that is all still good news too. Our vaccination rates I also didn't talk about. I talk a lot about our positive cases and that count because I see those numbers across my desk daily. But our vaccination rates also, I try to look at those at least weekly and see how they are because they move incrementally. It's little tiny fractions of percents that they go up, but it is definitely going up. And our counties now are much more vaccinated than they ever have been. We still are under, I think all of our counties are under the state average as far as vaccination rates go, but they are much higher than they had been. And we're grateful for that. I think between that and any kind of natural immunity that people may have had from having the disease itself, unfortunately, we're looking much better than we have previously. So.
All right, thank you, Amy. But we probably want to remind people if they do have questions, they can email those in to the health department on our website if we are not holding the bi-weekly meetings. So that's something to remember. And I don't have anything else unless you all have something else you want to share. We might want to share that flu shots, that season's here, and people should get their flu vaccination as well as COVID.
Absolutely. Laura's probably going to say more, but I don't think they're contraindicated. You can do flu vaccine and COVID at the same time, even. It's my understanding. But certainly we want to promote both for sure. We don't want people to get the flu either. That's That's been a killer also. Some of the measures we've taken to mitigate COVID, social distancing and masking and covering your cough and hand washing and all that are the same things that we've always said to do to prevent flu and to get your vaccine. So same messaging, just a different bug.
Yes, and flu vaccines are readily available. If you aren't able to get to the local health department, your pharmacies, most local pharmacies have those, as well as your local physicians. So check with us or check with your primary care or pharmacy. Get your flu shot.
Thank you all.
Thank you, Tracy.